Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
And I didn't eat after 4 o'clock, except maybe a couple of times I ran over to 5. But then I thought that we were on daylight saving time, so it still was 4 o'clock. But but I just wanted to report that. So I'm doing it again now till the 15th of June. So I'm going to see. Hopefully I lose 5 more and I'll be down to my 150 weight I want to be.
Oh, okay. Well, you're blessed.
Wow, yeah.
150.
But I had never lost 5 pounds in 15 days. I just thought I'd throw that out there.
Yeah. Wow. Yeah. It's hard to do. But,
yeah. I have a question. You didn't eat anything after 4, and what time did you go to bed?
Sometime 11, sometime 12, sometime 1.
Okay. And you didn't get hungry? You didn't get hungry?
I might have gotten hungry, but I didn't eat. I refused. The only thing I did after 4 o'clock was drink water.
The power of the mind, huh?
Yeah. So
what happened with the recording? John, what happened with the recording? I didn't see anything come through here.
Okay, well, you all have a good day. I know I probably will be off shortly.
Okay, happy birthday to you.
Thank you. I'll let him know.
John Tatum, what did you?
I think he's recording right now.
Oh, okay. Well, we didn't, usually it asks for permission, but it didn't do that. Okay, well, this is.
It did for me.
It did for me. For me too.
Too.
Maybe because the slide was up, it didn't come through for me. But anyway, this is an article that we put together about heart disease because so many people are dying from heart disease, and sometimes we forget how many people just drop dead. And sometimes it's because they're not aware of the subtle signs of heart disease. Somebody had a comment? But anyway, these are some of the subtle signs of heart disease. They're not so subtle though. If you struggle to breathe when lying flat, and then you put a pillow or two and you breathe better, that's a subtle sign of heart disease. Sometimes leg or hip pain aggravated by walking is because of clogged blood vessels in the legs or hips, and it could be an early sign that your blood vessels to your heart may be involved. Erectile dysfunction is also a result of clogged penile blood vessels. So it may be a sign that you need to get your heart vessels checked. Vaginal dryness is something that in females, particularly older females, may be a manifestation that there's clogging of blood vessels in the vagina. Swollen ankles are one of the early signs, it's one of the signs of heart disease. It's also a sign of liver disease. It's also a sign of kidney disease, but it's more often a sign of heart disease than almost anything else. Easy fatigability, getting tired easy, is also sometimes an early sign that your heart muscle is weakening. Waking up at night to urinate, especially if it's associated with swollen ankles, may be a sign that that your kidney is getting rid of fluids that backing up. Then bad breath is probably a less likely sign of heart disease, but periodontal disease and some articles we recently looked at point out that the bacteremia that's associated with periodontal disease may cause clogged arteries and strokes. And then finally, fatty growths, we call them xanthomas. You may, as you age, sometimes you get little growths and they can be related to high cholesterol levels, which we know increase the high likelihood of heart disease. And then whenever you have unexplained nausea, that's a sign. And if you have that associated with shortness of breath or chest pain or jaw pain or shoulder pain, may also be a sign of heart disease. Any comment about those 10 signs of heart disease?
Good morning, Dr. Callender. Where does the fatty growth show up?
Say again?
On that number, I think it was number 9, the fatty growth. Where does that normally show up?
Anywhere in your body, the skin.
So it's just like little lumps of fat?
Yes, that's correct. And we call it a xanthoma. Yeah. And it's usually associated with people who have a high cholesterol level.
Okay, thank you.
So if you
Dr. Callender,
yes.
a question going back up to bad breath, and I have a friend, yes, and everybody around her talks about how bad her breath is, and it really is horrible, almost smelling like a sewer. And you're looking at her, and polite, you just don't tell somebody that bad breath. I mean, it leaves you speechless. So should you tell them to get to a doctor quickly or what? It's just horrendous, and everybody notices it.
If you're a good friend, yes. It may
Okay.
end your friendship, but it's if you love her, it'd be good advice.
Because so many people joke about that. Here's a tic tac or something like that. But, I guess I would have to approach her very seriously and saying something is wrong.
Yeah.
But it's
Right.
hard.
Yeah, it's hard. It's not easy to tell the truth to people because the truth hurts.
Yeah.
And they may get angry at you for telling them the truth. But
Have
if
one
you
of
love them, and you really care about them, you could do
yeah,
that.
have a child tell them.
What? That's a joke.
Yeah.
No, that was serious. Because
Children,
children
children, they'll tell you something and no big deal. It's a matter of fact, especially you have one of those little children that just say whatever is on their mind. They haven't grown up yet to that they shouldn't say that.
Yeah, well.
But then if you tell them to tell them, they will tell on you too. Well, so-and-so told me to tell you. So you have to be careful around children, especially the type that will say it straight up.
It's not just you have bad breath, but you may have heart disease. It's an indication that you may have, heart disease. So you're actually concerned about their health to tell them that they may have periodontal disease, which could cause heart attack.
That's a good way of doing it. If there is a good way of doing it. That is
Dr. Cal, I didn't even know that your teeth did have effect on your heart, because I was listening to a commercial and they were saying your teeth, because the calcium, because they said you need to get your teeth cleaned at least twice a year, because the plaque and stuff that comes off your teeth goes to your heart and stuff. So yes,
bacteria.
Right. So
bacteria do it.
Carol, you just say, and when you tell her that even have a recommendation for a dentist that deals, because you need to see a dentist that deals with gums, because that I had that problem myself, dealing with, because I had braces. It runs in my family, a pyorrhea of the gums. So I have, I do due diligence, with my teeth.
Well, it's good when you partner it with the health aspect of it. Yeah.
Mm-hmm.
Maybe that makes it less painful to the person.
You can talk about heart disease without talking about the bad breath.
Say that again.
You can talk you can talk about heart disease without even addressing the bad breath.
Well, but I
Any
think
health professional that see.
but it helps to help them understand why you're talking about the heart disease and the fact that this may be a sign that you have heart disease. Well,
And another failed a method that has never failed me is just pray for an opening.
yeah, yeah.
How do doctors deal with patients who have extremely bad breath?
I've never encountered anybody like that.
I have.
I think
And
another way.
How'd you handle it?
talking about that they, straight up, that you have to take care of your health. In fact, one of the CMS initiatives is because of a young Black boy died from the complications of his bad oral health
Yeah,
here in the state of Maryland.
yeah, I remember.
And it really opened up for eligibility through CMS, that's Medicaid and Medicare, to see a dentist. So for children up to the age of 18, it's an entitlement. And as a pediatrician, it's a continual health maintenance issue. And often, because so many of our young people aren't well parented, telling them about these things is a social issue. So they're hurt, they're alienated, they're isolated from not only bad oral health, but when they don't wash properly, or the use of deodorants and learning how to clean themselves properly after defecation. Many of those issues, if you're not taught, and those who are taking care of you are oblivious to it, then it was an opportunity. And I've always prayed for an opening, but it has never resulted in someone not liking me, hating me, staying away from me, but in fact, it opened the door to more intimacy.
Thank you for sharing that. Thank you. I thought it was important while heart disease is a sign of decreased circulation in the heart, there are some screenings that may be available that may help to prevent progressive development of heart disease. And I've listed a number here: the ultrasound of the neck to detect carotid artery arteriosclerosis, which may be an early finding prior to a stroke or heart disease, and an ultrasound of the abdomen to detect an aortic aneurysm, which can be treated before it ruptures and kills you. And then EKG to look for atrial fibrillation, which is treatable and actually reversible in some circumstances. And then ankle brachial index, which is a test when you have circulation problems to your legs or your hands. And then, of course, elevated cholesterol levels. We have a number of articles on that. It's treatable. Some cholesterol levels are reducible by dietary mechanisms, but some are not and require medications. And then finally, the coronary calcium scan, which measures the amount of calcium in the blood vessels supplying the heart, is something that can be done painlessly and can alert you to the fact that you have something that needs to be treated. I don't know how many of you have taken advantage of any of these tests, but the technology is allowing these things to allow you to make a diagnosis. And then, of course, these are the lifestyle changes which are preventative for heart disease: exercising, meditating, eating more vegetables and fruit, eating less red meat and more plant proteins, drinking more water, keeping your blood pressure under 130/90, and stopping smoking. Those are some of the easier ways to begin lifestyle changes. Any comments on any of these things that we mentioned about heart disease, which is the #1 killer in the world, as well as in the United States?
One
Dr.
last comment about the bad breath thing. Face masks, particularly surgical masks, can block some of the smell. So if your assistant examines the patient first, you can have them give you a heads up so that you can come to the treatment with a face mask on.
The blood pressure is not 120/80, but it's 130/90. That means it's in.
Well, I said under 130/90.
Oh, okay, because it used to be.
Now, if you look at, it's interesting because you can find articles that say 120/80, and you have articles that say less than 130/90. But I think every year they come up with a different number. I can find articles that would say 120/80, and find articles that say less than 130/90. So I just made it something that's not that controversial. So keeping it under 120/80 is good as well, but certainly not higher than 130/90. Any other comments or questions? If not, this is a guide that may be helpful. I thought it was an interesting article. When it comes to medicine, women are not small men. I mean, it's interesting because when you talk about medicine, which now is predominantly female, most people who graduate from medical school these days are women, and women are women, and men are men, and to try to treat them as anything other than what they are is associated with many problems. One of the things that has been a problem is the fact that when women are as appropriately interactive as men are, they kind of get labeled as being offensive, when in point of fact, there should be no gender difference. If the truth is the truth and information is information. But while I say that, many men haven't yet learned how to accept the reality of that. And so this article is an attempt to help you realize that, as we have talked about for many times, that many articles and many surveys indicate that women may make the better doctors, make the best doctors. And so we should take them for who they are and what they are, and not judge them relative to their gender, except being respectful, of course. The other point is that women have been left out of research for so long that just like blacks have been left out of research so long, that it's engaging and nice to see that there's an emphasis in having more women and the blacks in research and everything else. Lucy, any comments on this issue as it relates to you and the practice of medicine?
I could keep you here to noon talking about this issue. But I guess it definitely is reflected in everything we see in issues of heart disease. Many of the way we medicine now especially, it's important to point out the horrible outrageous stats that we have about maternal mortality, issues around cardiovascular disease, health emergencies for women are because we've never really addressed many of those issues as it relates to the gender biases that we have. So, you know, it can't be said more and it can't be said louder. That it's important to realize that there are differences and we respond differently. And that's why DEI is so very, very important. The maternal mortality issue has been a biggie for me. I've had to intercede while postpartum physicians are in the hospital with a problem because they can't get attention. And that happened in 2023. Just thinking black women and Hispanic women are hysterical with their concerns. And they don't bring about immediate responses from the health community. So it's an issue. Intergestion and if yeah, I don't know if I thought it was a good interjection of this issue in the movie American Fiction. If you haven't seen it, it's an interesting movie. How heartburn was a heart attack, and usually, unfortunately, it's dismissed. And unfortunately, in this movie, you know what the outcome is, but it's a big issue.
Any other comments? If not,
Well, this is saying that, and we all know it, that women are different than men. And when it's coming to education or anything, even sports, especially the other community, the homosexual or whatever you call it, they're saying that we're the same and we should be able to compete and etc. Even educating, sometimes in the past we were saying there was different ways of educating. It may not be, but if they have this information and they're trying to enforce, whether it's on education or sports, and the medical science knows there is a difference, why are they letting this other community say there is no difference?
that's a good question. I don't have the answer, but that's an excellent question. And I agree with you.
What's their logical explanation that we all should use the same restroom?
Well, I'm not sure that we're mature enough to do that, but I do feel that women are women and men are men, and there are ways to differentiate, and they should be used consistently. One way.
in foreign countries, and so on, because I haven't been there much, do men and women use the same restrooms?
Yeah, someplace in Europe, yes.
How do they handle that? They have different stalls or what? Or everybody's out in the open?
I don't know. I know that they do have use similar restrooms, but the places I've gone to, they had separate males and females, but I did know that in places in Europe they do have they use the same restrooms. But I don't know.
And
I go to restrooms now where you don't all go in at the same time, but it's the same restroom for males and females.
Right, but you only can use it one at a time. Yeah.
There's a lot of common restrooms in Europe where both men and women are in the restroom at the same time, just in their different stalls.
Yeah, we haven't gotten to that point yet here.
Well, in DC, I went to a small business conference, and exactly what was stated was done. It was stated that you had a choice of bathroom. You could go to the second floor, where it's male and female, or you can go to the first floor, where all go in. And we were in such a hurry, this lady and I teamed up to go in to protect each other. And it was a surprise to me, to the point that I said I never would do that again. It was totally uncomfortable.
Okay, let's go to the next one, please. This is an interesting development that FDA has rejected once weekly insulin for approval in type 1 diabetes because the data just did not support it. This is something that we hope we get to the point where you only need insulin once a week, but so far the data has not allowed that to happen. And it's hopeful that this will come again. As with everything else, there's so many different ways of treating diabetes now, with the insulin pumps and with the other mechanisms. So that this is something that is likely to occur. One of the things that is very attractive is the fact that they have so many devices that you can insert that allow your blood sugars to be normalized without you doing anything else. And so I think eventually we'll get to the point where you have a insertable disc that allows you to take insulin once a week. That doesn't mean that you only need insulin once a week. It means that the disc will dispense the insulin for a week's supply. And it'll be dishing out insulin as necessary according to what the technology indicates is an abnormal blood sugar. So it's on the way, and it's just a matter of time before we actually get to that point. It's interesting how we have made so much progress since the development of Vibating and best of insulin, which was actually pork insulin. And now we get to the point where it's human insulin, but it's come a mighty long way. We still have people dying of diabetes, and young people and older people. And so it's a disease that is underdiagnosed and often undertreated. And it's a disease that affects almost every part of the body. So careful treatment of it becomes a lifelong commitment. As you know, there are people who are born with diabetes, type 1 diabetes, and there are people who develop it later. But type 1 means that your body does not produce, your pancreas does not produce insulin. Type 2 means your body produces insulin, but your body is resistant to the insulin that you produce. And so your blood sugars are abnormal. Any other comments or questions about this? These developments? Okay, let's go to the next
They're
slide.
catching up with Star Trek.
Yeah. This is an interesting article on something we've talked about many times, but there are 3 keys this article talks about, and physical performance is very important for people over 80. Sometimes we don't realize that. I realize after the age of 40, exercise is mandatory, but some people forget that just because you're over 80 doesn't mean you stop exercising. Probably means that it becomes more important to you surviving. And there's a suggestion that one of the vital signs that should be is the hand grip, because that talks about the ability to use your muscles. So that they think that physical performance is a primary target to enhance longevity and extend lifespan. So the more you exercise, the better off you are, of course. Everything has its strengths and its weaknesses, as we'll see later on. But some of the articles talk about people who exercise who drop dead while exercising. So it has its strengths and its weaknesses, but there are more benefits than there are drawbacks. Anybody disagree with this article's perspective? Now, this article that follows it is one that's interesting because there are many musicians who are on this in this group, and this says that singing in the choir, playing an instrument allows you to have a better memory at an old age. What are your thoughts, you musicians and non-musicians? No comments?
I'm planning on picking up an instrument again. That's my plan for September.
What instrument did you play before?
I got to second violin, first viola, and I would like to play the cello.
Any other comments?
Yeah, the cello is my favorite string instrument as well. I remember my mother passed away 7 years ago from Alzheimer's, and but I remember even toward the end when it was really getting bad, she could sit down at the piano and read much better than I've ever been able to read piano music and play it. It's pretty amazing how that works.
Yeah, it is.
I have to use sheet music because my memory is not all that good, so I rely on it. But I don't know. I don't know personally if it makes my memory better playing music, but definitely playing music with other people definitely is a benefit because you have to listen as well as perform at the same time to blend and balance.
I think music really enhances your lives. Different colleges, communities, they are giving senior citizens piano lessons or different instruments like that. And it's not even too late to take voice, but the choirs, they're coming back slowly. But just singing in choirs, whether it's a senior citizen choir or young people's choir, singing in choirs in churches really enhance people's lives. And they get to a certain age and they'll say, I'm too old to sing. But basically, they're not. So learning a new instrument really does exercise your brains, just going over an old instrument. So everyone that's on this panel should be doing something musically, if nothing but humming and whistling. But join a group.
You
Well,
know,
I'm a
my
strong.
only comment is that I agree with everything you said, but I remember my sister, who was a musician, by the way, par excellence, but she took up art in her old age and she became quite an artist. So I suspect art may also be in the same vein, but I haven't seen many articles on art.
Dr. Callender,
Yes.
I'm not a musician per se. I'm a music lover, and I have thousands of songs in my head. I listen to oldies most of the time, or listen to the blues, and I know the words to all these songs in my head. And I think that's why I can't get computers too well, because I think my brain is full. But I feel that is keeps you engaged. Music can engage you, and I think that's what uh what's necessary to keep you sharp and in the loop and involved with other people and things around you.
Okay, here's my take. Music is just it's a language expression. So each time you learn an instrument, you're learning another language. And if you learn a new instrument, you're learning another language. And you can even keep that going by learning other languages. What I mean by that is, there's courses like Babbel, Duolingo online, where you can learn other languages. So right now, I'm learning French, Spanish, and Korean.
Any other comments? Anybody else want to share? If not, this is an interesting article. Music activities that will keep you going for life. Singing in the choir or playing the piano improves the brain health, and it's interesting that music is such a universal language, and there's no scarcity of articles that support this position. Although I wonder if art taking up art can cause the same kind of result. I have no idea. I haven't seen any literature on it, but it's interesting to see how people who have musical talents and they develop interest in painting, how that expands their mental horizons as well.
I wanted to point
I
out
think
that you can click on this link right here, which says view, and you can listen to this video on your computer after the class, after our session.
Okay.
I think one of the things that we're learning from this is continuing to make pathways. And art, like music, continues to lay down new pathways, which must have the laying down of neurologic pathways, new ones, for me now lines up with hope, because it is a new venture. It's a hope, it's an improvement, it's a move forward, which I think always enhances life. Because we know those children who have neurologic and academic deficits tend to do better when they're able to put down a pathway, when they're involved in music, when they're involved in art. So I think we have not uncovered the mystery, but it seems like it's moving in that direction.
Good morning, everyone. Good morning, Dr. Callender. Thank you for this article. It reinforces my knowledge when I was teaching that I always played the classical for my students. And I talked about my mom last week about music that I played on YouTube. One other point that when I was in the rehab center and we were working with my mom, you know how as a math teacher that taught over 400 students, you had to change with the classes that came to you. And so when the pre-kindergartner and the early elementary student came, you know, we always sung that song about good morning to you. And so when I started visiting my mom and helping her, I would come into the rehab center, and you know, they keep those doors open to each room, and I would start saying good morning, good morning, good morning, good morning, and my mom would hear my voice and be trying to get out the bed. But I noticed that as I stayed there each week, that the people in the other room started looking forward to my saying good morning to me, and they started responding as well, and with a smile, because I always said good morning like I was talking to the early elementary kids, because I didn't know them. So it was a way of greeting. So I want to thank you for this article.
Okay, let's go to the next one. This is not. This is an interesting article about the jobs that they keep you from becoming demented. Of course, one of the problems. This is talking about the Norwegians, and it talks about the different kinds of jobs, and those jobs that stimulate you mentally are jobs that help you age gently, so to speak. And it talks about the fact that dementia increased nearly 40% in those people who were not engaged. And I think that the only shortcoming in this is that it doesn't really relate to people of color, but it's suggestive that when you have jobs that require cognitive involvement, MCI's moderate cognitive, I think, you know, what is it called? Cognitive, it has to do with cognitive activity. So that those things that allow your brain to develop called MCIs. So when you are involved in brain work, brain activity, thought producing activities, that helps your brain continue to function well. And when you cease to involve yourself in those kinds of activities, that decreases your ability to, yeah, there it is, right. Mhm. Of course, that fits right in with the musical article, which and that also helps with the chess players and the checker players and the artists, because they all are taking advantage of the cognitive activities. This is a interesting article about a new test for prostate cancer that may be more sensitive than the PSA. I say this is 95 to 99% accurate if it finds the genes that are associated with cancer. Then it is even better than the PSA. And of course, one of the problems with this test, though, is that it really hasn't been tested in people of color to the extent that it needs to be to see if this is as appropriate for people of color as it is for other people. And but so far, the evidence that we have is that if this test is positive, the 95 to 99% likelihood of having cancer, whereas if your PSA is increased, it's over 5, it isn't 99% accurate, but it gets up there though. It kind of eliminates false positives, which there are other conditions that can cause your PSA to rise, whereas that is unlikely to occur with this urine test. This urine test has not been used yet, but it is something that is coming. The only other thing, as this article says, is we need to do work in people of color, Latino, Hispanics, and African Americans need to be. It said only 12% of participants were identified as Black, which is better than it used to be, but we probably should have include Latinos and Blacks to see if it is truly as significant. But there's so many signs of a brighter tomorrow in terms of getting better tests to identify the presence or absence of cancer.
Dr. Callender, how did they test before?
What's
How
that?
did they test for prostate cancer before the urine test?
PSA, blood test.
Blood test, okay.
Blood test, yeah. And when the PSA went over 5, then that was suggestive of cancer. But there are other conditions that can also do that. But in most situations, that was a sign of cancer. And then they would do biopsies to prove it. Okay, next slide, please. Next article. This kind of is kind of a dumb article in many ways, because you know, sometimes we overdo associations. What they look for is to find out if you knew somebody who was psychotic or mentally ill. Does that mean that you're going to develop mental illness yourself? Well, what they did find this association. The question is, does that mean that it's transmissible? You need to have a better way of looking at it rather than to just identify. One of my friends has mental illness, therefore I have mental illness. And does that mean that it's transmissible? I would say no, it does not mean it's transmissible. It means that we need to do some additional studies to find out what you have in common between the people who develop mental illness who are your friends, rather than to say that mental illness is now transmissible. But anyway, that's what this article is about, saying that if you have a friend who's mentally ill, you may become mentally ill also.
Well, Dr. Callender, have you ever heard that statement, "You're driving me crazy"?
Yes, I have. Many times.
Dr. Callender, I knew in a small town where my aunt lived, there was a young man that the whole town knew that had some mental illness, whatever. And I said on that comment, does that mean the whole town? Because the whole town knew him. So, so I agree, no.
Yeah.
Dr. Callender,
Yes.
I wonder, because I've been thinking about this since the last election, when the masses of people became enamored and in a spell under number 45 president. And those people are still under that spell and delusion.
Right.
So I'm wondering, I'm thinking that could be true.
Interesting.
I agree.
Well, the way
But they have had articles about that, and people that end up in cults and a way of thinking and become disillusional and etc. And that they're actually being programmed that way. It's not by association, but they're being programmed. And adolescents, if you're thinking about it, and their minds being molded, some of even their sexual behavior is by their association with someone else or something similar, and they change altogether until they seek help. But I have seen that happen. You're around someone and you begin to take their attributes and traits over yourself by just being associated with them. I don't think it's something that we should really laugh about, especially if someone is just leaning or going over toward that. And we got half of Americans that are in a cult, and they don't recognize the signs that they're in a cult.
Any other comment?
Yes, Dr. Callender, is there a difference between this and bullying or peer pressure?
Yeah. Yeah, there's a difference. The difference is that they are just saying that the association of one with the other. And bullying means that you force somebody to do something. That's the implication. Whereas with this, there was just the fact that they were associated with them without the bullying connotation. And I think that it all depends on your mindset. Yeah. You have a mindset that believes you should imitate somebody, then you go ahead and do that. You have a mindset that you want to stand alone and be individual, then that depends. So, and everybody varies. You know, psychology is the understanding of why one person does one thing and somebody else does another thing. And we all have different motivating influences. And some are followers and some are leaders. And what makes the difference? And that's why one can say that there's an association, but in point of fact, there may or may not be.
I tend to think that we may be generalizing, thinking about like schizophrenia or something like that. But I think this article focuses more on anxiety and depression. And those are maybe less severe, of course, than psychosis, but they could be even more possibly transmitted. You know, if you're around somebody who's depressed or somebody who's anxious or somebody who's on that what do you call it, the bi spectrum, where they have extreme highs and extreme lows.
Manic depression real.
Yeah, so it definitely can have an effect on you as well. Thanks.
Any other comments?
For a long time, it had been associated that because many of our communities, people who had were later diagnosed or were diagnosed with a psychotic illness tended to move from higher socioeconomic communities to lower socioeconomic communities because they could operate or manage them easier. And so therefore you had more of a concentration. And that's something to consider. Poorer communities, lower socioeconomic communities are associated with more observation. The community is observed at a higher degree and with greater scrutiny than more affluent communities. And that in and of itself has a significant impact on other members of the community. So it becomes very important that we address and we're sensitive to many of those issues and address them appropriately. Adverse childhood experiences we know have significant impact on later relationships and fulfillment of aspirations, academic achievement. All of those things are significantly associated with that. So it's not a direct relationship, but there is an impact.
Well, I think the important thing is that association is not causation. Because something is associated does not mean that it is caused by. And that to me is the danger of saying that something is transmissible. That's saying something completely different. Saying that something is transmissible means that it is caused by that. And that's where I disagree with that concept of transmissibility of mental illness, because this article does not demonstrate that. It just demonstrates that there's an association. And I think that because you're associated does not mean that it causes it. Any other comments?
Totally agree. Totally agree.
Any other comments? This is this is for those who do tattoos. We did not come in a generation that did tattoos, and now of course we have this generation where half the people you see have tattoos of one sort or another, or have a ring in the nose or the ear or something. And now we find out that it may be a risk factor for lymphoma. And this is frightening because, of course, this is something that, again, is talking about Swedish adults. And whether this relates to people of color, I don't know. But I know this article does not. So But anyway, they did find in Swedes that the tattoos were associated with lymphomas. Whether that has anything to do with our people of color is another question. How many of your children or grandchildren have tattoos?
We do, but there's nothing we can do about it. We preach to them and said all sorts of stuff. And then I look up there some more. So I'm trying to say less so that I won't see any more popping up. The one child got her whole back and all that kind of stuff. And I'm going, oh, Lord have mercy. But anyway, they're just trying me.
And my son has several tattoos. Kareem, he's got them on his neck, on his arm. But you know, I've seen people with tattoos practically changing their whole body.
Yeah.
From this color to the tattoo color over their whole body. It's weird. And
Yeah.
I wonder what happens to them if they try to get a job, you know, at a law firm or something like that, in a doctor's office.
Well, information is power. Right now, I don't think all these kids realize that it creates a risk for cancer, and so that's the information that we should be spreading. Okay, now that people have the tattoos, they just need to know what type of symptoms that are available for lymphoma that these tattoos could be causing, and it's the painless lumps in the neck, armpit, groin areas. You know, that could be some of the symptoms that they need to get treated for possible malignant lymphoma.
Thank you very much.
I've also investigated on how much it'll cost to get it off. If you get it removed, does it change your chance of getting lymphoma?
I think it would increase. I think it would increase because you're having a attack to the skin again.
Haven't seen any data on that yet, which is an interesting question. What does it take to remove the tattoos, and what damage does that do? Yeah, so.
Well, Dr. Callender, my son had some years ago had to go in for surgery, and we were all standing there when the doctor was talking to him, and the doctor asked, "Do you have any tattoos?" And he said no. And I asked if he had tattoo, what would be the effects? And he said we would have to cover them up so it wouldn't interfere with the surgery. And I said, what would you use? He said we would use some type of like masking tape to cover it.
Any other comments? Now let's go to the next one. This is another association article in which post-traumatic headache. Well, when you get trauma to the head, that means you get bleeding. If you have bleeding, you have iron, which is in the hemoglobin. So which comes first, the chicken or the egg? And so they have identified increased iron, and they think that it means that the iron is the problem. In point of fact, it's the trauma that is the problem. But anyway, it's an article that identifies the association, once again, of iron, not actually appreciating the fact that iron is in the hemoglobin. So when you bleed, when you have trauma, you bleed, you have more iron. And so is the iron the problem, or is the bleeding the problem? And that's what this article is trying to differentiate. To me, it does not do it successfully, but anyway, that's what this article is all about. How do you distinguish the two? You really can't. So it doesn't have much to do with the ingestion of iron, but just with the fact that when you have bleeding, iron is in the hemoglobin, and so when you bleed, there is, of course, iron deposited. Now, nowadays, almost everybody has head trauma has a CT, CTE to look and see, and that's why it becomes easier to associate this. And then, of course, if you get migraine afterwards, the question is, are the two associated? And is it because of the iron from the hemorrhage or not? So it's not a definitive answer to that question. But we're seeing so much more trauma, head trauma, with so many accidents. One of the better ways is to decrease the number of falls and accidents that we have, so you don't have so many post-traumatic bleeds.
Can we say that professional sports also should be involved with this, like football, rugby?
Well, yeah, football, and more football and rugby than baseball and basketball, but this is a great article that actually talks about the bad carbs that are actually great for your brain. And when you look at these so-called bad carbs, they're not so bad after all. But it's a very good article on terms of the carbs that benefit brain health. And when they talk about the carbs, they talk about fruits and vegetables, which we already know are good for you. And of course, one of the best, they identify the 5 or 6 carbs that they feel are best for you. And what you notice in common is that very few of them are ultra processed. So that these carbs that have the flavonoids that berries have and those things. And they talk about eating strawberries and blueberries that delay cognitive decline. And so it's a very nice article. Go down the line and show you that whole wheat, whole grain bread. Talk about not white bread, because white bread is ultra processed. And potatoes, they of course are talking about not French fries or any of that stuff, but the fact that they're rich in potassium, which lowers the blood pressure as well. And then enriched bread and cereal, again, they're talking about whole bread. And then nuts, which seems to be one of the best sources of antioxidants. And then dried fruits, and contrary to what you would think, natural sweeteners, not sugar, of course. Sugar is well known to be increased cognitive decline, but the sweeteners are shown to improve your memory. And then they conclude by pointing out that you really should be part of a balanced diet. Increasing fruits and vegetables and combining them with healthy habits are the way to go. And the closes by saying it's never too late to start. So better late than never, but better early than late. This is an interesting articles on 7 canned foods you should never buy. And it's interesting they identify them. Fruit cocktail is something, one of them that they talk about. Then it goes on to look at the other ones. I'd never heard of refried beans, but I guess that's something that some people eat. And have you heard of canned refried beans?
Very, very popular in Hispanic diets.
Yeah, you can find it. You can find it in the international section of those international stores.
Yeah, I had bought a can and I'm gonna throw it away.
Then canned pre-cooked pasta. Never heard of that either. But,
For children.
oh, I see. And then the tuna, white tuna. So, and that's because of the mercury that has been mentioned before. Then canned Vienna sausages.
Yummy.
And then good old Campbell's chicken noodle soup.
Wow.
Which they say is nothing but salt.
Yeah. Yes.
Blasphemy.
But they had some with low salt.
Yeah, we may have that, but that variety is salt rich.
Dr. Callender, a family member was eating some soup, right? And they took the can and put the can into a bowl, put it in the microwave. And I says, well, my mother used to take the can, and she used soup in a hurry as a quick backup. She would take the can and she would pour 5 or 6 containers of water. I mean, it would end up being a big pot of soup. And now I understand why, because of the sodium in it. And and so I was trying to tell them that one can of soup is supposed to feed a whole family, not just one person. And they would say, well, the direction said this and this and this and this. And I was trying to read the direction, trying to remember exactly where that theory came from. And then I finally found a can that says that you dilute with water. But nowadays, everybody wants some research or something to prove what you're saying.
This is information is power era. Let's go to the next one, please. About 1 in 3 Americans have lost someone to a drug overdose. How many of you lost relatives due to a drug overdose? Anybody in this group?
Yes.
See 3 hands at least.
Yes.
It's about 1 in 3, huh? We have 15 people in the program today.
Dr. Callender, can I ask the question? How many on this group, 1 out of 3, have lost someone due to COVID?
Oh, COVID.
Mm-hmm.
I know my hand was up.
I have also.
Mine too.
Yeah, so most have.
Mm.
Yeah. COVID was really a killer, as they say. Wow. And most of them, not talking about one, but more than one.
Mhm.
Only problem is that, COVID is pretty much contained now. But fentanyl use and opioids are still increasing as far as I can tell. And
That's correct.
the deaths are off the charts. Unbelievable. And they're putting fentanyl in everything that you buy as a drug off the street has fentanyl in it. That makes you keep coming back and eventually will kill you.
And the fentanyl is the symptom.
Fentanyl is a killer.
It's a killer, but that's at the end. We are not putting the attention to how the bodies are coming down the river and ending up with the fentanyl.
Well, fentanyl
We
doesn't
talked
belong
about-
in the diet. I mean,
Excuse me?
fentanyl is an anesthetic agent.
Right.
And-
And I'm saying that we don't put enough attention on why people are self-medicating.
Why are
Where's
they?
the music in school? Where's the communication? All of these things are symptoms of where we've messed up. I don't know anybody, and I've taken care of thousands of people who have had addicted disease, and none of them wanted to be that way.
Mm.
So fentanyl is a symptom. The overdoses are a symptom of a society, a community that's not working for the people who use it. We talked about music programs, everybody.
But addiction is just one of the many problems of our society. I mean, the biggest problem is the homicide issue, where we're killing each other because we're so unhappy. We have such a distorted social setting. You look at our kids who grow up, and those that don't go to school, they have but one thing to do, and that's criminal activity, because they don't know how to survive in the world, and that to me is the common denominator of all the things that you mentioned, because they're all part of the social failure that we have in front of us. And it's tough to think about what else can we do to do better. You have so many people trying to make a difference in this world, to overcome some of the social ills that we have. But in spite of it, the homicide continues. Blacks killing blacks, and it's just so horrifying to see what has come of our society. To see how we have the rich and the poor remain poor, and the rich remain rich. And the social ills that we have, we seem not to be making headway much. As you're pointing out, that the fentanyl is just a sign of that social disease we have.
And we cannot miss this opportunity to point out how important it is that we get our young people, we get everybody to vote, to vote, to vote, to vote. Because if the Republicans, I'm very concerned that if Trump gets elected, what we think is bad will become horrifying.
That's a great fear.
Okay,
Great.
I just
I
noticed
remember
that
when
if
people,
I just noticed that regardless of whether or not we've got a Republican or Democrat in the White House, that people still shoot each other, are depressed, are crazy, are drug addicted. They do all the bad things at the same rate, regardless of politics. It just says that, as somebody mentioned earlier, we're not a very happy society.
That says it all.
yeah, and going on to that, what Darryl was saying, I've noticed, especially around young people in their 20s and 30s, you ask them, how are you? And the phrase that I'm hearing more and more, and I'm really tuned into it, first thing they said, I'm tired. And that seems to be one of the slogans I'm hearing. And I wasn't, cognizant at first, but now I'm really aware. I ask young people, 20s and 30s, how are you? Oh, I'm tired. And I don't know whether it's a fad to say that, or are they really, do we have a tired generation? And they're doing nothing, but they're tired. They're not doing
Well,
any physical work or anything, but they just say, I'm tired. Anybody
I,
else notice that?
I
Yeah,
believe them. If somebody says they're tired, they really are.
they're staying up all night playing video games.
Well, not necessarily. If you okay, a lot of kids are sleeping with their iPhones or their smartphones plugged in their ears. They don't sleep at night because they get notifications all through the night. Every time somebody is, their feed of Instagram, Facebook, TikTok, or whatever, they're waking up all night to look at their feeds on their phones. If they're not plugged in their ears, the phones are right by their bed. They ding all through the night.
And that leads to depression. It leads to drugs. And we're having a society, they're getting less physical exercise, the children particularly. They're staying up late. They even in Virginia, they decided from now on, which they always had studies, not to start school at 7 in the morning, but maybe wait till 9 because that adolescent needs their rest and sleep. Children are actually tired. You have young adults that are tired, they're depressed and don't know why. Our society, we're killing ourselves.
Well spoken.
Touche. Touche.
Yeah.
Well, all that we can really manage is our families, and for a lot of us, it means managing our grandkids. And we really need to take a deep dive into all the little things that are blocking happiness from the young, because they're not just going to turn 21 and become happy. They're going to be unhappy 21-year-old, 30, 40, 60 years old, but we got to stop the cycle when we can.
I guess we can go to the next one after that. That says it all. I don't understand the big thing about this article, but what he's saying is that the data is not great in terms of why he decided to add masks to it. He thought it was the right thing to do, and he did it. I find it alarming that they would pummel him about questions about what caused the pandemic. I mean, we know what caused it. The question is, why did it come from China and then go throughout the rest of the world unchecked? And they're trying to blame him for that. And that's interesting that our society is still dealing with the blame game so much that we may be missing the fact that we need to have a way so that when people do things like that, we'll keep it from becoming a pandemic.
Absolutely.
That's what we need to do. Well, this may be the last one for us. It just Moderna is approved for vaccine for older adults, and of course, it's already been approved and it's been used by other companies anyway. So that's not much news there, but just another company that's producing the RSV vaccine. Of course, what is interesting is that this is the first year that we've had that kind of RSV vaccine, because in the past they were not able to develop the vaccine. So we've come to get to the point where we have a vaccine, which is very positive.
Vaccines were never a moneymaker for big pharma. And definitely
Change.
the coronavirus brought Pfizer from the grave.
Yeah. Yeah. Okay, well, that's the last one. It's 10:30 in September. It's glad we're having some many people with us.